Okay, so before we start our blood transfusion today, I'm just going to verify a couple things in the patient's chart. First, I'm going to verify the provider's orders, when it was ordered, how long it's supposed to be transfusing for, and things like that. I'm also going to verify the indication for the blood transfusion today, what the provider's indication is, and also the lab values for the patient. I'm going to verify that a cross type and match has been done within 72 hours, as well as the consent form has been signed for a patient. Once I've verified all of those, I'm going to go get my stuff for the procedure. Before I touch the blood bag, I'm going to put on gloves. We've received this blood bag from the blood bank, and we're going to make sure that we infuse it within 30 minutes of receiving it from the blood bank. I'm also going to check, make sure there's no bubbles, clots, it's not purple in color, there's no leaking, and it's not expired. I've checked all of that, so I'm just have all my supplies here: saline bag, flush, and tubing. So now I'm just gonna go chat with the patient and inform them about the procedure. So, hi, my name is Avery. I'm gonna be your nurse today. Can I verify your name and your date of birth?
My name is John. My date of birth is that.
Okay, wonderful. John, today we're going to be doing a blood transfusion. This has been ordered by the provider because your hematocrit levels are low, and so we just want to bring those up. It's going to help you with healing and feeling better. Do you have any allergies that you're aware of?
Nope.
Okay, wonderful. So some signs and symptoms that we're going to watch for as we're doing this transfusion. We want to watch out for any fever, chills, any like back pain or chest pain, any shortness of breath, rash. Those are the most common symptoms we see if there is any reaction, but I'm also going to be staying with you to monitor those and also your vital signs to make sure that everything's flowing good. I'm just going to do a full set of vitals, but before I do that, do I still have consent to do this procedure with you?
Yes.
Okay, and do you have any questions for me?
Nope.
Okay, wonderful. I'm going to do a full set of vitals. I'm going to get heart rate, respiration rate, O2 stat, temperature, and blood pressure. Everything looks good, so I'm going to go ahead and get my materials to set up the procedure, and I'm also going to verify with a nurse that everything is consistent with the patient information and the order. So I have the provider order right here, and I also have the sign-off sheet. So the first thing I'm going to do is I'm going to check the patient information to the tag on the bag. So it is Robert Crowley.
Correct.
Robert Crowley. Patient MRN is 815-4485, 815-4485.
Mm-hmm.
And then I'm going to verify patient date of birth, 12/21, 12/21. And then I'm going to verify the tag to the bag. So the blood type is B positive, B positive. Expiration date is good. The unit number is this, and it's the same as the unit number right here. Can you verify that for me?
Yep.
Okay, wonderful. So everything looks good there. So now that those have been verified, I'm just going to have a second nurse sign that off for me, and we can start preparing things for the transfusion. So I'm going to leave that blood bag here for now, and I'm going to start setting up the saline. We're going to make sure that all the caps are on, everything stays sterile, and that this is a clean procedure. There's caps on all of these things. I'm going to start by clamping off the side that will be for the blood transfusion, opening the side that will be for the saline bag. I will spike the bag, and I'm going to let it run all the way through. Okay, making sure that all bubbles are out, and I've clamped it. I also want to make sure that the saline fills the filter line. Okay, and the saline has filled the gotten to the filter line, and I make sure that there is a cap on here, that everything is maintaining a clean aseptic technique. I'm just gonna put this right here for now. And then I'm going to get the blood. I'm gonna invert the blood bag 2 to 3 times just to make sure that it still looks good, and nothing is settled. And so after I've done the saline, I'm gonna clamp that side and unclamp the side for the blood, and this line is still clamped. I'm going to take the side that has been unclamped and spike the bag. I'm going to hook this up, and we're also going to make sure that this would be higher than the saline. And then I'm going to unclamp this, being careful again that all the ports are clean, but also that I don't lose any blood, but I am going to let it flow to the bottom. Tracking the blood as we go and clamping the line before wasting any blood. Now that all that is set, I'm just going to check the patient's IV. I'm checking the IV to make sure there's no signs of swelling, redness, infiltration, leaking. I don't see any of that, so I'm going to get an alcohol wipe, clean this area for 10 seconds. Okay, and then I'm going to insert this flush, unclamp it, and I'm just looking as I'm pushing to see that it's flowing well, that there's no signs of infiltration or fluid leaking out of the IV place. Everything looks good. Is there any pain when I do that?
Nope.
Okay, wonderful. So now that the IV looks good and that's been checked, we can set up the blood transfusion. So I'm going to turn on the machine. Okay, and I'm going to make sure that I select, let's see, okay, let's see here. Okay, so we're doing blood, red blood cells, correct. The provider wants us to infuse at 1 ml per minute for the first 15 minutes, so we're going to be setting it at 60 mLs per hour. And the volume to be infused is 350. So I am going to now hook this up to the patient after I've done all of my checks. I'm going to do patient 5 rights, that this is the right patient, right time, right route, right dose, right medication, and that it has not been expired. So now I'm going to unclamp it so it can start flowing to the patient after I've done my 5 rights. I'm going to click start. And we're going to let it infuse for the first 15 minutes. I'm going to stay here with the patient during that time. I'm going to do a vitals check at 5 minutes. I'm going to simulate that it has been 5 minutes. We've checked all the vitals and everything looks good. And then I'm going to simulate again at 15 minutes. So I'll do another vitals check at the 15-minute mark. Everything looks good. The patient has had no signs of, let's see. Okay. And just again, making sure that all the lines are clear, which they are. Perfect. Okay. And then checking that the patient has had no signs of fever, chills, back pain, chest pain, shortness of breath, rash, sweating, anything like that. So now that we've done all of those checks, we can change the volume to be infused, so that it infuses over 2 to 3 hours. We want to make sure that that has been done within 2 to 3 hours of receiving it from the blood bank, so that's why we've changed the infusion rate. Again, I just want to notify you of the different signs and symptoms to watch out for. If you have any questions, I'll be back. You also have your call light right here. I'm just making sure the bed is in low and locked position, side rails up, and I'm going to go document the procedure. Doing hand hygiene and disposing of all my supplies.